Molly Schneider, Cone Health's Director of Retail and Specialty Pharmacy Services, is here talking all things pharmacy related. So we're going to set the record straight on some very common pharmacy related misconceptions. Okay, so this is something that a lot of people believe, that you have to be a Cone Health employee or patient to get your prescriptions filled at Cone Health.
You do not have to be a Cone Health employee or patient to get your prescriptions filled at most of our pharmacies. We are here to provide services to our entire community.
Okay, another misconception is my prescription is already set up at another pharmacy, so I just can't move it no matter what.
That is not true either. Most prescriptions can be transferred. The only prescriptions that can't be transferred are some controlled substance prescriptions where they have to stay at the pharmacy that they were sent to. To get a prescription transferred, what you would do is call the pharmacy where you want to have your prescription filled and give them the information about that prescription, the pharmacy where it is, the name of the medication, and that pharmacy will call the other pharmacy, transfer all the information over, get the prescription filled for you, and let you know when it's ready.
Okay, so we do need to have that information though. The pharmacy where it was filled, maybe the phone number or the address, and also the kind of prescription it was.
Yes, yeah, we need the name of the medication and the phone number of the pharmacy where it was filled.
Okay, good to know. All right, number 3, I don't get to choose where I get my prescriptions filled. That's a misconception.
That is a misconception. You absolutely have choice as to where you get your prescriptions filled. So oftentimes your physician, when you go to see your doctor, they'll ask what pharmacy you want to use. Sometimes they don't. If they don't ask, tell them that this is the pharmacy I want my prescription to go to. And they can e-prescribe your prescription there. They can send it electronically, or they can give you a paper copy and you can take it into the pharmacy.
Okay. A fourth misconception, only prescription medications are available at Cone Health community pharmacy locations.
That is also a misconception. We have over-the-counter medications and supplies at all of our pharmacies. Some of our pharmacies have the supplies back behind the pharmacy counter, so you might have to ask a staff member for something that you want, but you should be able to get all of your OTC needs met at our Cone Health community pharmacy locations. We also offer vaccines. So we offer flu vaccines and COVID vaccines, shingles and pneumococcal, and several other vaccines. If you're interested in that, contact one of our pharmacies and they can help get you set up to get a vaccine there.
So that was going to be kind of like a follow-up question. If people want to know more about your locations, because one might be closer to their house than what they've been filling their prescriptions with, or maybe, you know, some of the pharmacies that are open later or 24 hours or even some of those things, how do they find that information?
So you can get information about our pharmacies at our website. It's conehealth.com/community-pharmacy. And it's got information about all of our locations and our hours.
Okay, and then what other things do people need to know about pharmacy services as a part, like, of their well-being journey?
As a pharmacist, our mission is really to help people. We want you to make the most of your time and your money and your well-being. So we can help you with your OTCs or your prescription needs, your refills, any supplements that you might take. So please ask us questions. Please don't hesitate to ask us questions and really understand your healthcare.
And you know, when we ask those questions or when we go there to get our prescription filled, we probably need to be a little patient too, because sometimes it may not look as busy, but you guys are busy back there. Is that one of the things that you wish people would kind of know a little bit?
That is one of the things I wish people would know. It does take a few minutes to fill a prescription. And so just because your doctor sent it over doesn't mean it's going to be immediately ready when you get to the pharmacy. We do need some time to work through any insurance issues that we may have, go through your medication profile and make sure there's not any drug interactions or disease interactions so that we're providing safe health care to you.
Right, because you want to make sure that all the things are right and everything is supposed to work the way that it's supposed to work. All right, thank you so much for joining us.